Good evening, everyone. How are you all? So welcome to First Aid AMC and MC Clinical 2 weeks free sessions again. So this is Dr. Arshan, and tonight we are going to have the random role play sessions, as you know already by the schedule. Now, let me introduce with you with one of your another mentor for the next 5 months course, who is Dr. Cynthia. And Dr. Cynthia is going to take your role play sessions mostly. And I don't need to say anything about her because you will find out how amazing teacher she is. So she's going to take over the session tonight. And this session is mainly on just a random role play, which we take every week. And it helps you a lot with the new cages and everything. And like, this is one of the most favorite class in the course. So we can start now. And I will hand over my mic to Dr. Cynthia. Thank you all.
Hello, everyone. I'm Dr. Cynthia. Hope you all are doing well. I'm going to take your role play session. Today's session is definitely free session. Hope you will enjoy, guys. So, yeah, I think we can start. Let me share my screen first. So who wants to do role play with me first? It would be random.
I can do it.
Okay.
Hi, doctor. I can do it.
Okay. Hi. Whom I'm talking with?
I'm Hajar.
Okay. Sure. So I'm going to show you the case. It would be 2-minute reading time and 8-minute performance. Okay. When
Yes,
you're
thank you.
minute finished, you need to be stopped. Okay.
Yes, thank you.
So let's start. Your 2-minute reading time starts now.
Thank you.
You can start.
Yes. Can I see the X-ray?
You can start, then you need to ask me about X-ray.
Okay. Hello, I'm Dr. Hajar, one of the GPs here. Today, I can see that you come here regarding your baby, and I'm sorry about his condition, and but I want to let you know that he is in the good hand at this moment. Would you please first let me know about your concern and regarding your expectation for today?
Yes, doctor, I'm really concerned about my son Joseph because 1 week ago I came here. You did his physical examination. You told me everything was normal that time, but I'm concerned about his cough.
Yes, thank you for explanation about that. Let me first to explain to you regarding the X-ray. In the X-ray, it shows that the chest of your son, and as you can see in this X-ray, shows that some part white and the other part shows that black. Regarding the white parts, it shows the bones and shows the heart shadow, and regarding the black one shows the lung tissue. In this case, in this X-ray, mostly shows that the heart shadow is a little bit become enlarged, and but I want to check. I should check with my senior about that. But my concern is regarding the lung tissues. As you can see in both sides, left and right side of the X-ray, I can see a little bit become gray, and it means that there is maybe fluid inside of that, or maybe infection inside of that. For this reason, I think that there is a infection inside of the lung, and increasing the size of the a little bit size of the heart. I cannot see the air pipe completely, but we should check the site of that too in the X-ray. Based on this X-ray and history, I think that maybe he suffered from the lung infection we call as a pneumonia. I'm sorry that I use the jargon, but it means that the infection of the lung. I think about other reasons, for example, due to for example, bacterial infection we call as a pertussis, specifically because of his history. We call as a whooping cough. But first of all, I should know about the previous history of the vaccination. Even with the vaccination, he may have this problem too. Are you with me so far?
Yes, doctor.
Do you have any question?
So what do you think, doctor? What's my son acting now?
Yes, at this moment, I think about the infection. As I mentioned to you, the infection of the lung, pneumonia, and the pertussis that I mentioned. The other things is the croup. Croup is the kind of infection of the food pipe by the viral infection, but mostly I think about the first diagnosis that I mentioned to you regarding the infection of the lung. At this moment, I should admit him in the hospital, and based on the specialist opinion, maybe need to do more investigation for him, and started for him antibiotic as a drip antibiotic inside of the veins, and then during this time you can be with him. Don't worry, it's a serious condition, but it's has a cure for that, and as soon as we start the antibiotic can help him. But if without treatment, it can be life-threatening, and the infection can go through the blood. We should do some investigations such as blood tests to be sure that infection is just inside of the lung, not go through the blood, and check the kidney function. And regarding the heart, we should do echocardiogram. It's related to the heart, but about this one, I'm not sure. I will check with my senior. Do you have any questions so far?
How you are going to manage this condition, doctor?
I mentioned I will start the antibiotic for him as soon as possible. The IV antibiotic, it means that through the veins. During this time, whenever his fever under control, and then he can discharge from the hospital and maybe continue with the oral antibiotic. Regarding the other, if it is pertussis, as I mentioned to you, whooping cough, then maybe need to give the antibiotic to the other people who contacts with him too. The other things regarding the vaccination, I should be sure that his vaccination is up to date. Is his vaccination up to date? Is he received the vaccine, childhood vaccination? Mm-hmm. Okay. And the other things, yes, just this. Do you have any question?
Anything else that I need to know, doctor?
The other things, no, at this moment, I cannot remember anything else.
Okay. You still have time.
Yes, it's so important that nobody smoke around him, because it can cause the condition worse. And the other things, yes, for the yes, I cannot remember anything else. I'm sorry.
You want me to stop your timer?
Yes, because I cannot remember anything else. Thank you.
So it's Dr. Hajar.
Yes.
Your performance is nice. Your approach is fine. In here, what thing I want to tell you, when you start, because nowadays our exam procedure is like 2 ways, either in online or face-to-face. So if you notice your task is anything like any investigation you need to explain, you cannot ask, and because no examiner available in online, okay? So your task should be, you should start your introduction first, and in the meantime you will get your x-ray or any investigation report, okay? So don't waste your time, just start, because when 8 minutes starts, that means your performance already started, okay?
Yes.
Now introduction here, I think you need to just from my point of view, I think you need to just little bit improve your introduction, because here mom is really concerned. Mom already visited GP last week. Again, she came here today because she's concerned about Joseph's current cough situation. Okay, so you need to put more empathy in here. Now coming to the step. Based on the step and look at your task. Very important is you have to be very careful about your task. Based on your STEM and task, it mentioned that you have to make a diagnosis, and it should be single diagnosis. But I noticed you are really smart. You told me like 3 important differential. That's really fantastic. But in this type of case, what you need to do, you have to do make one like probable most possible diagnosis. Okay.
Yes.
Because here is STEM given, your task is diagnosis management, and management, you have to make a one diagnosis. Okay. So here the diagnosis, it should be pertussis. Now, what I noticed, Dr. Hazar, I think you haven't noticed your task properly, because you have 4 tasks. And last task was course of the disease. That means you have to mention about either prognosis or complication of the disease.
Yes.
If you like, your performance is fantastic, but if you missed any of your tasks, you are going to fail.
Yes.
Okay? So that's it. So best of luck. Let's discuss the case. So here, Joseph, 18 months old, came with mother to GP clinic today. 1 week ago, presented with runny nose to GP. Previous physical examination was normal and diagnosed as upper respiratory tract infection, and also sent home and asked to come back if worsen the situation. Today, the child again presented with cough, which lasts long. He has history of vomiting at the end. Please read the stem very carefully. They already mentioned he has a cough, vomiting at the end, vomited twice. They have done many investigations like COVID negative. Other father had flu-like symptoms, but mother and little brother condition is normal. Physical examination mostly normal, but when they try to collect a throat swab, they notice there is a sound at the end. It's a very important point in this system. So your task is explain the X-ray, diagnosis, reason, management, and course of the disease. So basically, what could be your differential in this child present with the cough? Our differential should be pertussis, COVID infection. It could be post-viral cough, because there is a history of upper respiratory tract infection. It could be simple upper respiratory tract infection, psychogenic cough, asthma, allergic rhinitis, GERD. It could be heart-related problem. So those are your important differential according to the age group. Okay. Now, look, your task is not the history. You have to directly start explain the X-ray. Definitely introduce yourself nicely, like how we are generally introduced. Hi, I'm Dr. X. I'll be looking after your child. I know it must be very difficult situation for you, but don't worry, I'll try my best to help your son. Okay, in this way, you can start your conversation. So history not your task. I'm not going to explain the history. Your task is explain the X-ray. So what we can see in the X-ray, usually in pertussis X-ray, it should be normal. Okay, especially mild infection, mild to moderate, it should be like normal. So what we can see in the X-ray, I would suggest guys, if you will get any X-ray, you can follow the mnemonic of A, B, C, D. A for ear, B for bone, C for cardiac shadow, and D for diaphragm. That's how you can explain your X-ray either to the mom or either to your examiner, whatever it will come to your exam. Okay, so based on the X-ray, we can see like ear, that means like compared to the right and left side, it almost similar. B for bones, like I couldn't appreciate any abnormalities. C, cardiac shadow, yes, I noticed heart shadow is like little bit shaggy heart shadow, I can appreciate. And D, diaphragm is normal in position, it's not high up, not like that, not abnormal diaphragm. So based on that, and I can see some infiltration. What does it mean? You can say like in a layman term, you can say some denser substance. It might be like more ER, might be fluid over there, but it's not that much. It's just a mild infiltration. Okay. What does it mean? It might be little bit infection of the lung. Simple term, we can say just little infection of the lung. You can mention it. Okay. So yes, based on the X-ray, we notice like shaggy heart shadow and mild infiltration. So in here, you can say from the history and physical examination and the X-ray, most likely your child is having a condition, we call it pertussis. Normally, we call it whooping cough, okay? It is an infection of the airways caused by the bug, which is extremely contagious. It is usually spread by tiny droplets of fluid from infected person, like coughing or sneezing. And most likely he has got it like either from the father. Okay, if your task gives some differential, if you're not sure about your diagnosis, you could say some differential, like it could be croup. So what I noticed Dr. Hazar mentioned, croup means it's an infection of the food pipe. No, group is the infection of the airways, voice box, and upper part of the lung. Okay. And other differential, you can say it's a pneumonia, which is an infection of the lung caused by the bug. It could be one of the possibilities, but there is no fever. Okay. And other possibility, it could be like post-viral cough. It could be just simple viral infection, COVID infection, but COVID infection, we have already done swab test, which came as normal. So based on that, you can mention, although your baby and other members are immunized against the bug, but unfortunately, it doesn't give 100% protection. Okay, but don't worry, it's a manageable condition. Definitely, whenever you are saying something or making a diagnosis, you are making parents scared, you have to compensate it. Okay. And at this point, usually in pertussis, no need to do any investigation, but we can do nasopharyngeal swab test. But look, STEM already mentioned they have done swab test. Okay. Now coming to the treatment part, your another task was diagnosis and the management. So key point here is start antibiotic. Now guys, another thing for your clinical exam. Clinical exam is all about your smartness. Okay. So whenever you are going to start any antibiotic, make sure that you are asking, do you have any, or your child has any allergies of any antibiotic? Okay, because you are going to give erythromycin. So ask, does your child have any allergies of any antibiotics? Okay. So not only you are giving antibiotic to the child, you are also giving antibiotic to other members of the family. So those are the key point in here. Another key point, when you are suspecting it's a pertussis, you have to notify it to the Department of Health Service and exclusion from school and childcare. Okay. You have to mention we are going to exclusion from school and childcare for 5 days after starting of the antibiotic. You need to mention it. Now coming to the last part, that was your course of the disease. Okay, you should not skip any of your tasks. So the 4th task means course of the disease, that means complication, implication, you can mention. So all are the same. Here you can say pertussis, it can cause, if we are not going to treat it, it can cause cessation of respiration, we call it apnea. Okay, it can cause dehydration. The infection can affect the whole lung, we call it pneumonia. It can cause collapse of the lung, we call it atelectasis, emphysema. It can cause seizure, fit, or hypoxic encephalopathy. That means lack of oxygen to the brain and produces some, confusion, abnormal behavior. So those things you have to mention. So that's the case, very simple case, but based on the STEM, you need to make a diagnosis. That's it. So the case is simple. When we know the diagnosis, that would be easier for you. But based on the STEM, you have to make a diagnosis. Okay.
Excuse me.
Thank you, doctor.
What would be the dumb?
It would be great if you are writing any question on the chat box. If my approach and everything is good, but I misdiagnose the case, will I be past the case? No, you can't, because few cases you have to make a diagnosis. Like when we saw like the feedback, there we all know that there is 16 cases, 14 among like 14 is the scored 1, 2 is the pilot one. So few of the case, predominant assessment area is the diagnostic formulation. That means you have to make a correct diagnosis. If you are not making correct diagnosis, you will definitely fail this case. What about the diagnosis of a ARDS due to pertussis or other infection? What does it mean? The management, so your management, it should be antibiotic and definitely school exclusion, and notify the Department of Health Service your management, okay? Because we have already done X-ray and swab test. If X-ray swab test not done, so another thing, guys, I want to tell you, management means it will come everything. Management includes your investigation, your immediate, your long-term management. So 3 parts, okay? Make sure you cover those 3 parts. Here, look why I didn't mention any investigation, because investigation already done. Regarding the reason, here reason is bug infection. It's a Bordetella pertussis. You can say simply it's a bug infection. Okay. What are the differential? As I mentioned, differential, it could be pertussis, COVID infection, post-viral cough, pneumonia, croup. It could be heart problem. Those are your differential. It could be psychogenic cough, asthma, allergic rhinitis, jar, but those are less likely. Acute respiratory distress syndrome. I'm not sure about your question. Do you have to mention oral or IV antibiotic? In this case, like we are going to give oral antibiotic, okay? Okay, who will be the next one?
Doctor, may I proceed?
I would like to do.
This is Dr. Lakshmi.
I'm not sure.
Yes, please.
This is Dr. Lakshmi.
Doctor, I wrote my name in the beginning.
I was told. I was talking at the beginning.
Who?
With Dr. Lakshmi.
Okay, that's fine.
Oh, doctor, I wrote my name in the beginning, like after Hajar, I wrote in the beginning. Can I try, please?
Okay, just
Doctor, actually, I talked to initially.
okay. It's Dr. Marwa.
Yes, I am.
Okay, Dr. Marwa, is that all right? If Dr. Lakshmi can proceed fast?
Yes, it's okay. Thank you.
Okay. So Dr. Lakshmi, it's your case, and your 2 minutes starts now. Okay, you can start.
Thank you, doctor. Hi, this is Dr. Lakshmi, one of the doctor here. How are you today?
I'm not good, doctor. I'm having severe itchiness on my tummy.
Yeah, on your tummy.
Yeah.
Okay, I'm so sorry to hear about it, Amanda. Don't worry, I'm here to help you, and you are in safe hand. All right, Amanda.
Okay.
Amanda, apart from your itchiness, I can see that you were 35 weeks gestation. So how is your pregnancy going so far?
My pregnancy is going fine, doctor, till now.
Fantastic. Congratulations for your pregnancy. Amanda, now can you tell me a bit more about your problem so that I can assess you better? Would that be okay with you if I ask a few more questions regarding your itchiness and current health?
Sure.
Thank you for your cooperation. Amanda, can you tell me since when you are having this itchiness?
I'm having this itchiness for a month, doctor.
All right. And is that and it has happened suddenly or gradually?
Gradually.
All right. How severe is itchiness in a scale of 1 to 10? Are you able to tolerate?
I would say 7, sometimes 8.
All right. Did you have you applied anything on your tummy?
No, doctor.
All right. And anywhere else rather than your tummy?
No, mostly in my tummy.
All right. And before you get pregnant, did you have any itchiness?
No.
All right. And now, can you tell me, do you have any allergy to anything?
Like what?
Like, do you have any allergy to any medication, any foods, or anything else?
No.
All right. Now, can you tell me one thing? Is there any discharge coming over there?
I haven't noticed.
Is it painful, Amanda?
Not really, doctor.
All right. Is there anything makes it worse or better?
No, I haven't noticed yet.
Okay, Amanda. And Amanda, are you regular with your antenatal checkup?
I try to regular.
Okay. Have you done your 11 to 13 weeks Down syndrome screening?
Yes.
What was the result?
They mentioned it was normal.
Okay. And have you done your 18 weeks ultrasound?
Yes.
What was the result?
So far normal. I can remember. Yeah.
Okay. Have you done your 28 weeks ultrasound? I mean, sugar drink test?
Yes, doctor.
What was the result?
Normal.
Okay. And did you take, I mean, are you on folic acid?
Now.
All right. And
Are you asking now?
no. Okay. And now can you tell me, are you regular with your cervical screening test?
Yes, doctor.
Okay. Okay, Amanda. Do you have any past medical history of diabetes mellitus or high blood sugar, I mean, hypertension or any other disease that I need to be aware of?
No.
Okay. Any family history of similar condition?
No.
Do you smoke and drink alcohol?
No, doctor.
I really appreciate it. And have you applied any new cosmetics on your tummy?
No.
Did you change your shower gel recently?
No.
Any history of insect bite?
No.
All right. And now, thank you, Amanda, for your all information. And that one important thing, Amanda, do you feel your baby kick?
Yes, I feel it.
Good. And do you know your blood group?
O positive.
All right. And thank you, Amanda, for your information. Amanda, actually, I can see that you are having itchiness on your tummy, which is really distressing. I understand during this period. So first of all, I would like to say it's totally harmless condition during pregnancy. You know, due to some hormonal change during pregnancy, this rash actually appeared. Actually, after whenever you'll over your pregnancy period, after delivery it will goes away, so there is nothing to be worried about. Usually it's a very common condition during pregnancy. So are you with me so far?
Yes.
All right. So at the moment, I would like to tell you one thing. Try to, if I know it's a itchiness, itchy, it's a bit irritable. So I'm giving you some antihistamine. You can take it if you feel more itchy, and I'm giving you some soothing cream. If you can apply on it for temporary purpose, and if it is affecting more, or if it is very much troublesome, then I will give you very low dose steroid. So otherwise, I think there is nothing to be worried about. It will go whenever you deliver your baby after that. So it will take some time. So I think there is nothing to be worried about. All right, Amanda?
Okay, anything else that I need to know?
Yeah, and apart from this, Amanda, you have to maintain good healthy lifestyle. Like you have to continue, you have to maintain hygiene, as well as you have to take plenty of water and consume green leafy vegetables and do some exercise, little bit simple exercise, not vigorous exercise. And I'm giving you some reading material, Amanda, about this rash during pregnancy, so that you'll get a better idea. And do you have any question? Then you can ask me.
So how long it will last?
Okay, that's a good question. I really appreciate you. Actually, whenever you deliver your baby, it can take around 3 to 4 months to get resolved completely. So, and after delivery, I'll review you. So if anything, if we are concerned about this, then definitely I'll refer you to the specialist for the further management and assessment as well.
Okay. And doctor, does it affect my baby?
No, that's a really good question. I understand. I really appreciate your concern. It doesn't cause any harm, anything. It doesn't, or not even a single problem. It can affect your baby. So I think you can be free, relaxed.
Anything else that I need to know?
No, I think that's all. So if you have any question, then you can ask me.
Okay.
And that one important thing, Amanda, in the meantime, if you see that you are 35 weeks gestation, if you see that you are not feeling your baby kick and you're having fever or any bleeding from you down below and your condition getting worse, then immediately come to the emergency department.
Okay.
Thank you for your cooperation.
Okay. You still have time, 20 seconds. So let's finish. It's the Dr. Lakshmi. Your performance is nice. You finished with time. There is no issues with time management. History was quite okay, but you missed few points. Though I know your management is okay. Diagnosis, I couldn't remember. Did you tell me any specific diagnosis?
I forgot the name, doctor.
Exactly. So in here, you okay. No worries. And that's why I was confused. Like I couldn't hear anything that you make a specific diagnosis, but yeah, that was a really smart choice that you proceed with nicely. Your diagnosis management is fine. So in here history, you missed few of the point, Dr. Lakshmi. The few important point is, did you ask me the morphology of the rash? So what does it mean? It means that, did you ask me about the severity of the rash, any oozing from there? So those questions are missing. And also, I feel like, yes, definitely you didn't mention me the appropriate diagnosis. So it's a polymorphic eruption of the pregnancy. And management, you missed key point of the management, that is the topical steroid cream. Okay. So let's discuss the case. You are at a GP settings, 28 years old, Amanda. Present to you itchiness. She is in 35 weeks of gestation. Task is take a history, give diagnosis and management. So in here, you can give like first introduce yourself, how Dr. Lakshmi introduced herself. It was nice. Confidentiality statement. Why? Because you are asking some personal question. Okay, so you can give confidentiality state at the beginning, or while you are asking about private question, that time you can give. Now coming to the open-ended question, you should start asking with rash question. Okay, so here, where do you feel itchiness over my stretch mark area and how long? Anything makes it worse, anything makes it better. Definitely those are your common question. Is it for the first time or not? Where did it appear first? And do you think it's progressive anywhere else of the body? And is it itchy? It's a very itchy. Do you notice any scaly formation, any oozing, any discharge? Is it painful? Those things. Coming to the associated symptom, sign symptom question, that is sore throat, any runny nose, vomiting, nausea, those are important question. Fever question, definitely you have to ask, because like any rash, we need to ask about fever. Okay. If you notice fever, then ask details about fever question, but in here fever is negative, so but definitely you have to ask about fever question. Now coming to the associated, as I mentioned, any tummy pain, because patient is pregnant, any history of trauma to the tummy, then are you bleeding from anywhere else, any bleeding disorder question. What you can get, if you ask about the morphology of the rash to the patient, sometimes you will get a picture. Okay, so the picture would be like that. Okay, now coming to the, are you bleeding from anywhere else? Then ask about the details antenatal checkup question. Okay, how about your blood test, 5th month scan, how about 28 sugar drink test? Those things you can ask, like routine antenatal checkup, 18 weeks, how about your scan, have you done your Down syndrome screening, what about your blood group, and do you know about your blood group, do you have enough support from your partner, have you taken folic acid in your first 3 months of your pregnancy. Okay, and very, very important question, can you feel your baby kick? Any of your OBS case, make sure you are asking 4 questions, especially if you notice in your exam OBS case coming with 3rd trimester, make sure you are asking 4 questions. 1 question is baby kick, do you have enough support, blood group, and folic acid, have you taken folic acid? Okay, if you ask those 4 questions, you will cover many things. Okay, because baby kick is really important. Now 3rd trimester patient coming, so make sure you are asking 3rd trimester complication question as well. So 3rd trimester life-threatening or emergency complication, we need to ask about any headache, leg swelling, any fluid or blood coming from your private area. Okay, now any medication are you on, any past history of medical or surgical illness, any smoking, alcohol, recreational drugs use, those questions are the routine question. And you can ask about, did you change your like any cosmetics or shower gel recently? Okay, so the diagnosis is to make a definitive diagnosis is key point in here, because your task is history, diagnosis, and management. It's a polymorphic eruption of pregnancy, which is a very itchy condition, and we can see like sometimes a bumpy rash, and usually that rash starts on the stretch mark of the tummy. Okay, and it usually appears last 3 months of the pregnancy, and after the delivery it will resolve spontaneously. So it's not an uncommon condition, and it's not a serious condition as well. Okay, now you can mention about the sign symptom. Yes, sign symptom, like usually the rash appears 3rd trimester, it lasts few weeks of the pregnancy, you can mention, and very itchy sometimes, like due to itchiness it's really difficult to sleep at night. Okay, and diagnosis, usually we are making diagnosis clinically, no need for any investigation. Okay, what could be your other differential? Your other differential could be atopic eczema, contact dermatitis, it could be like hives, psoriasis, any drug induced, it could be like allergic reaction, pimpoid, gestations, those things you can mention. Coming to the treatment, so most important treatment, you can say there is no specific curative treatment for polymorphic eruption of pregnancy apart from delivery. What we can do, we can just go for symptom control management. You are complaining me about severe itchiness. What I can offer you, I can give you emollients. Okay, you have to apply that moisturizer. You need to apply it frequently. Another important drug is topical steroid. Okay, you can use it. Another thing is that I can give you antihistamine. Sometimes they ask you, doctor, I heard that antihistamine is like not safe for the pregnancy. You can say later stage of the pregnancy, we can use antihistamine. Okay, if you really need it. And sometimes they ask you, doctor, is it affecting my baby? You should say no. Okay, and does it affect your future pregnancy? It is very uncommon for polymorphic reaction of pregnancy to recur. Okay. Another thing you mentioned, like how long it will last, you can say like it will usually last until the delivery, then usually resolved within 4 to 6 weeks. Okay. So that's it.
Thank you, Dr. Cynthia, for your nice feedback.
Okay, no worries. Best of luck, doctor.
Thank you.
Okay, so can we kindly offer the opportunity to role play according to the chat box, please? I forget the list actually. Is there any list that you already make who will be the next one? Because I have to check again from the beginning. So please kindly remember your position and just let me know. Did you ask about P and poo? Yes, Dr. Lakshmi, she also forget to ask about P and poo. Definitely we need to ask about any color changes because in later pregnancy, we need to make sure there is no any problem in cholestasis. Those things you have to ask. Yes, she missed about severity of that itchiness. She missed that one. Herpes? No, it's not a herpes. It's there is no vesicular type of rash. It's not like herpes. It's not herpes. Okay, the rash pattern is a small pink papules appear first along your stretch mark area. Okay. But based on the picture, it's I couldn't appreciate any vesicle. Okay. Any sick person contact recently? I think she asked that question, but if she missed that, that's also good question. You can ask any sick person contact recently. Family history, yes, definitely, like any past medical family history you have to ask. Mostly treatment is symptomatic. You can mention about the moisturizer and topical steroid applied. And if it is really itchy, you can't manage, so you can give her antihistamine. That's okay. For cholestasis, you should ask about pee and poo color changes. Dr. Javed sometimes when you ask about the rash morphology, can you please describe me? Is there any oozing, discharge, vesicle? Then you will get pictures sometimes. Okay, who will be the next one? Because I have no list.
I would like to do the next one, if possible.
The list is written.
I'd like to do.
Doctor, the list, if you scroll up to the beginning of this chat, there is a list.
Okay, I need to see.
Dr. Senator, from last time, and Dr. Ashen asked me to remind you because I should be have a role play this time, becoming the queue.
Okay, list means okay, it's Dr. Namia.
No, Doctor, it's my turn.
You want to perform?
Can I please?
Okay, sure.
Hey, Doctor, I know it by heart. If someone wants to take it, I'm happy with that. Thank you very much.
Okay, no worries.
Thank
So, Dr. Namia.
Yes.
Okay,
Hello, doctor.
you want to try?
Okay, I will try.
You want to start?
Okay. Hello, Fiona. I am Dr. Namia, one of the doctors here. I have found from the notes that you are taking one medication for sleep for the past 1 year. I am very sorry to see that. I know you'll be very distressed as you are taking this medication, but don't worry. You are here, you'll be safe, and I will do my best to find out what is distressing you, and we will find out what possible solutions can be done. So Fiona, let me assure you that whatever you talk, it will be between you and me, unless it is harmful to you or others. And don't feel embarrassed or judgmental. You can tell anything to me, and I will try my best to help to clear you out. So can you tell me more about your problem?
Doctor, I need a sleeping pill for my sleep.
Now I'm going to examine your baby from head to toe, looking for any abnormality. Now I'm going to examine your
Sorry?
baby from head to toe, looking for any abnormality. I'll be very gentle throughout the examination. Let me know if you feel uncomfortable. Now I'm going.
Okay. you can-
Sorry, who is talking?
I'm not sure who is talking.
Okay.
Okay.
Okay. So what is causing you this what's the problem that making you not sleeping? Is it, are you having difficulty in initiating the sleep? Fiona, can you?
Yes. Not initiating problem, doctor, but I feel I'm having problem with sleep, doctor, and I took sleeping pill for last 1 year. I need sleeping pill. I'm here for the prescription.
Okay, so I would like to ask you more about why you are taking, because taking this sleep medication for a long time will affect your health and your mental condition. So it would be nice that if you tell me what is the problem that is making you distressed. So clearing this out will also help to clear your mind and will help to get better mental health. So how long have you been taking this medication?
Last 1 year.
Okay. So with this medication, are you able to have a good sleep?
Yes, doctor.
Okay. So are you taking this daily?
Yes.
Okay, then. So are you having some nightmares? So are you getting up from the sleep at some times?
Yes, doctor. No
Okay,
nightmare, but I got up in the middle of the night.
okay, that I'm sorry to hear that. So let me ask you, do you have any past sad experience before that it's haunting you?
No.
Okay. How is your mood now? Are you feeling all right?
My mood is okay.
Okay. Are there any situation where you're having a low mood or a high mood?
No.
No. Okay, that's good. And how is your appetite? Are you eating well?
Yes.
Okay. Do you wake up early from the sleep?
Yes, doctor.
Okay, then. Mm-hmm. Okay. Do you think life is worth living?
Yes, I think so.
Okay, that's good. Do you have any passing thoughts of harming yourself or others?
No.
Okay, that's good. Okay, I'm going to ask some screening questions that may feel strange to you. Is that all right?
Yes.
Okay. Do you see or feel or hear anything that others don't?
No.
Okay. Do you have do you feel that someone is trying to harm you?
No, doctor.
Okay, that's good. Or someone is controlling you? Do you think that someone is trying to control you?
No.
Okay. Are you guilty of anything?
Not really.
Okay, you can tell me whatever it is. I can assure you that it will be between us. We can find it out.
Okay.
Is there any past episode that is haunting you?
No.
Okay. What is that you are guilty about? Can you tell me, please?
No, doctor. I'm not guilty.
What is that then? Okay. Okay then. Do you feel that someone is inserting thoughts on you or
No,
something like? Okay, then good. Do you think you have some superpowers?
no.
Okay. Mm, okay. Then can I ask you where you are now?
I'm at your clinic.
Okay, that's good. What time it is and what day?
Yeah, it's nighttime.
Okay, that's good. Okay, can I ask if there is fire in the room, what will you do?
I'm running away.
Okay, that's good. So do you think you need medication for this problem?
Definitely, I need medication for my sleep.
Okay. Okay, how is your studies going on?
My study is not going good, doctor.
Okay, what happened?
I can't concentrate at my study.
Okay, so is that the reason why you are taking the sleep pills?
I'm not sure, doctor. I
Okay.
can't sleep
How is your
properly.
exams? How is your exams going? Do you have good results in it?
I couldn't concentrate at my study. My exam is okay.
Okay, I'm sorry to hear that. So do you have stress in your university or house in
Um,
regard to this?
yes, doctor. I
Okay,
couldn't make a good progress at my academic career.
okay, I understand. So that's okay. You can try hard and concentrate. There is, I think,
Okay, your time's up, doctor.
okay, okay.
Okay. So your name is Namia.
Namia,
The
yes.
performance is in here. Like at the beginning, you asked me nice question. You asked me psychosocial history, home situation, some depression question, hallucination, delusional question. That's fine. But this type of case, yes, I noticed like your tone was also low, nice. In introduction, that was okay. But you need to act more like naturally when you ask me like at the beginning you were telling me too many sentences together, but you should just give a pause and ask your question, how are you right now? Like
Okay,
this way you can make a good rapport with your patient. Okay.
okay,
uh, just assume you are talking to your real patient. Okay, just act like.
okay,
And in this type of psychiatric cases, your task was take a history, discuss the cause of the insomnia. Okay,
yes,
so in
yes.
here, what I noticed in depression, when you notice there is a sleep problem, when you notice some sign symptoms of depression, make sure you are asking all sign symptoms of depression. Okay, so those things are missing. Another thing is that your also task is to find out the cause of the insomnia. And
Yes, I couldn't
you
find it out.
you didn't touch your second task. That's okay. So let's discuss the case. Here, young girl Fiona, 19 years old, has been taking temazepam for 1 year due to sleep problem. Task is take a history, discuss cause of insomnia with this patient. Here you need to introduce yourself nicely, then mention about confidentiality statement, then ask about history of presenting complaint. Here, patient coming with you regarding like sleep issues, and she is asking you to give sleeping pill. In here, you should ask about sleep problem details, why you can't sleep, and like was it initiating problem or just middle of the night you woke up and you can't go back to sleep, and how long you were suffering from this problem, who prescribed temazepam, and which dose you are taking it for how long, did it help, do you increase the dose recently, or like what happened if you're not taking temazepam, what you feel really. Could you sleep well without it? You should ask. Now, when you notice there is a, like in the middle of the night, your patient woke up and can't go back to sleep, definitely you have to ask all depression question. We all know that, like DSM-5 criteria. According to that, there is a mnemonic that is the MC scap. Okay, M for mood. How about your mood? How about your mood? Anytime low mood, high mood so far. How about your sleep? So definitely we already asked all the sleep question. Interest. Do you find interest in your workplace or hobbies? Do you feel guilty by any chance? How about your energy? How about your concentration, appetite, psychomotor sign symptom? That is likely those like any psychotic feature, hallucination, delusional question you have to ask. Any suicide idea. Make sure you are asking suicide idea. That is key point in here. Okay. Psychosocial history details. So based on the psychosocial history, we all know that like mood, sleep, appetite, those questions. Then your how about hallucination? Any auditory, visual hallucination, delusion, paranoia, persecutory, delusion of guilt, grandiosity. Those things you have to ask. And if you notice any psychotic feature, then you can ask about orientation, judgment. Okay, but trust me, for this type of case, patient coming to you for for the medication, if you are asking about like where are you now at this moment, so it kills your time.
Okay.
Okay, because we need to make sure we have to finish within 6 minutes. If your task, 2 tasks, we have to finish 6 minutes and you need to explain your condition within 2 minutes. Coming to the head assess, that means home situation. How about your home condition? Are you a student or are you working? How about your job or workplace situation? Any stress going in your home or in your workplace? Those things you have to ask. Apart from that, is smoking, alcohol, recreational drugs. And very quickly, organic cause. Why? Because your second task asks you to find out the cause of the insomnia. Okay, so any psychiatric cases, make sure you are asking 4 things. That is weather preference, any like injury to your head, any nasty changes, that means loss of weight, loss of appetite. Okay, those questions you are asking. And another is the infection, any recent fever or flu-like illness. Any past medical history, any mental problem, any family history of similar type of problem, or you had similar problem before. Now, your diagnosis, it should be it's a mild depression. Okay, because there is a sleep problem, patient also there is a problem in concentration. When if Dr. Namia, if you are asking me about interest, I would say I lost my interest. So there are few things positive. So it's a mild depression, but patient has no suicidal ideation. Okay.
Okay.
So you can mention, I don't think sleeping pill is the right option for you. We must treat the underlying cause. So I will refer you to the psychologist for talk therapy. They will teach you how to deal with the stress in our life. Okay. If not better, that time I will refer you to the psychiatrist. They will prescribe you medication for your mood, for your concentration, for your that in sleeping problem as well. And in the meantime, I will arrange family meeting if you are going to give consent. If you notice there is a stress, definitely there is a stress, you should say take days off, enjoy your free time, like offer family meeting, advise sleep hygiene. And your second task is causes of insomnia. Here, causes of insomnia, it could be lifestyle stress. It could be adjustment disorder. If you are asking me about home situation, I would say I'm living alone. Okay, so here it could be adjustment disorder, lifestyle stress because university problem going on. It could be generalized anxiety disorder. It could be post-traumatic stress disorder, but there is no traumatic event. It could be anxiety disorder, but I couldn't appreciate any anxiety in your history. It could be bipolar mood disorder. Okay, but you didn't mention any high mood so far. It could be drug induced, substance abuse, or any organic cause. So you have to mention about the causes of insomnia. Okay, what could be the causes of insomnia, and in your patient case, what is the reason of the insomnia? In your patient case, reason of the insomnia, it could be due to the stress, and also along with mild depression, sometimes medication itself can cause insomnia. Okay. Okay.
Okay. Thank you, Dr. Cynthia, for your
Yeah.
feedback.
Yes. Okay. How differentiate from prurigo of pregnancy? Okay, basically prurigo of pregnancy and polymorphic erection of pregnancy, both are the similar condition, but not exactly the same. Okay, that thing happen any trimester of the pregnancy, especially like second trimester can also happen in prurigo of the pregnancy, and also it is not confined that definitely you have to be start appear in your stress mark. It can have appear any parts of your body. Okay, and it's not that much common condition, so always think about common condition first. How many cases we are going to discuss, it depends about time. Ask about work, uni, ask about family partner. Okay, she already ask about the dose of temozepam she's taking. Yes, psychomotor question you can ask about hallucination, delusional question, those things like it's covered. Any acute psychosis, acute psychotic feature you can ask. Do you have to address dependence of the temazepam? Yes, like I already mentioned, how many tablets you are taking. By any chance you increase the dose. Do you have to address dependence? We have to change to diazepam and taper it slowly, isn't it? Dr. Afza, did you notice your task is not the management? Okay, your task is discuss cause of insomnia, like discuss all the causes of insomnia. If your task is management proper, that time you can mention, but at this moment no need to mention like tapering the those things. Lifestyle stress, you can notice there is obvious like stress going on, and like that's really affect your patient life. And you notice sometimes patient also complain about headache or tummy pain, some of the physical symptoms. Adjustment disorder also patients sometimes complain with you, some like headache, tummy pain. But in here, adjustment, mostly in MC clinical, they will give you positive finding about like living alone, or they will change the state. They recently changed the state, or again, they they are living alone. Those things, MC clinical related, I notice it. Can we ask, did you try talk therapy? You can ask whatever you want, but always remember your time is limited. You have only 8 minutes. Okay, so let's move to the next one. Okay, for lifestyle stress adjustment disorder, look, any of the cases, if you are taking history, definitely we have to ask how long do you feel this, and you have to correlate with the symptoms. Definitely with the duration, in lifestyle stress or adjustment disorder, you can mention it. Will be the next one.
I would like to do it. Can I do it?
I'm not sure who is in the queue.
Hello, doctor. Dr. Chatu was for a long time in the queue.
Okay.
Yeah.
So, Dr. Chatu, yeah, this is your case. And let me know when you are ready.
Yeah.
For lifestyle, sorry for interrupting, Dr. Chatu. For
Yeah.
lifestyle stress, like patients sometimes give you symptoms like for few months as well, sometimes 6 months as well, lifestyle stress, or few months, they can mention it. But in adjustment disorder, it should be in 3 months, but 1 month, it should be like you change your state, and after that, you are having your symptoms. Okay. 1 month after that. But within 3 months time, you are having the symptoms. Are you asking those questions about duration? Okay, sure. So yes, Dr. Chatu, this is your case, and let me know when you are ready.
Okay, I'll start.
Okay.
Good afternoon. I'm Chatu, one of the doctors. How can I address you?
Hi, Doctor. I'm Alex.
Alex, nice to meet you, Alex. Alex, I understand that you have a painful hip. Is that right, Alex?
Yes, doctor.
So you've been told by the GP that your symptoms weren't too bad for a surgery. What are the concerns you have this time, Alex?
Yes, doctor, I'm having bad hip on my right side, and doctor, day by day, it's really very tough for me. I couldn't walk properly. It's pain all the time there, and it's really disturbing my life. 1 year ago, my GP told me that that stage I didn't need any surgery, but now I feel like I need surgery, doctor.
Thank you, Alex. I'm really sorry, Alex, that you are going through this. I can only imagine how difficult it is for you to carry on your day-to-day life. So I appreciate that you're here. Can I quickly ask some questions so that I can understand what's exactly going on with you? Is that all right, Alex?
Sure, doctor.
I might ask some home situation questions as well, but all the information will be between you and me. Is that all right, Alex?
Okay.
Thank you so much. So, Alex, can you tell me when did this hip problem started exactly?
I'm having these issues for like almost 5 years, doctor.
Okay. Do you think this pain is progressively increasing?
Yes, doctor. It's getting worse day by day.
Okay. Is it more during the morning or in the night?
I would say the daytime.
During the daytime. Okay. Can you tell me it's on the right hip? Yeah, exactly.
Yeah.
On the scale of 10, how bad is the pain? If 0 is no pain, 10 is the highest pain.
Sometimes it's 8, doctor.
8. Are you in the pain right now, Alex?
I'm okay.
Okay, okay. Does it increase when you walk or when you do things?
Yes, doctor. It's really tough for me and for my walking. I couldn't walk properly.
I'm really sorry, Alex, that you're going through this. Does it improve when you rest?
Sometimes.
Okay. Do you have any pain on the other hip as well?
No.
What about joints, other joints?
I have some joint pain, but in my right hip is really worse.
Okay. By any chance, do you have any redness or rashes around that body?
No.
Sorry, around the joint?
No.
Is it hot to touch?
No.
By any chance, did you have a fall?
No, doctor.
Okay. Have you ever had any falls recently within the last 6 months or 1 year?
I had a history of fall.
Okay.
So,
Okay. Have you done any replacement of any other knee or other hip or anything like that before?
no.
Okay. Have you been told that you have, do you have, can you tell me about your day-to-day things? So do you find it difficult to get up from the bed in the morning?
Definitely, doctor.
Yeah.
I have some problem and I couldn't take my dog to the park for a walk because I couldn't walk properly.
Okay. Okay. How do you walk at the moment? Do you use any mobility aids, Alex?
Yes, doctor.
What do you use? Sorry?
Stick.
Walking stick. Okay. How about getting yourself dressed up and going to the toilet? Are those things difficult as well?
I just noticed, doctor, like I couldn't walk properly and it's really affecting my life.
Okay. Do you drive? Can you drive?
No.
Do you have enough support at home? Who lives with you, Alex?
I live with my wife.
Okay. Apart from that, do you have any fevers or rashes on the body?
No.
Any loss of appetite, loss of weight?
No.
Any lumps and bumps on the body?
No.
Do you have any problems with your waterworks and bowel works?
No.
Do you have any other illnesses which I should be aware of? Are you taking any medication for anything else?
No, doctor.
Okay. So you are living with your wife. Do you have enough support at home? All right. Okay. Okay. Do you smoke or do you take alcohol, Alex?
I do smoking and alcohol in the weekend.
Smoke cigarettes, how much per day? How many?
4 to 5 cigarettes per day.
All right. Okay. What do you take for pain at home, Alex, usually?
Panadol.
Okay. With that, it improves?
Sometimes.
Okay. So thank you so much for the history, Alex. So let me explain what it is. So the in this, what we are going to do is total hip replacement. So there are certain risks which carries this surgery. Sometimes, let me tell you, like it is a ball and socket joint. So the hip and the thigh bone together. So there are certain risks with this surgery: infections, bleeding, and the nearby structures can be damaged. And there are some blood vessels, nerves, and some ligaments which is binding the joint in place. These structures could be damaged as well. These are the risks which carries it. And also sometimes during the surgery, around the lip of the socket, sometimes tiny fractures could happen. These are the risks which carries this. What happens during the surgery is, before the surgery, the whole team, surgeons, anesthetists, and everyone will assess you for the fitness for the surgery. Your hip will be replaced most likely by a metal kind of artificial hip. Are you with me, Alex? Do you have concerns so far?
Yes, doctor.
Okay, so Alex, the thing is, like, even though these risks are there in place, this will give much more benefits as well, and the whole multidisciplinary team approach will reduce most of this risk because of this skill. The benefits are it will decrease your pain and your day-to-day things like getting up from the bed, getting dressed, walking your dog. All these things will be possible eventually after the surgery, so you can get back to your baseline. But the thing is, it won't happen right away after the surgery, because we will have to put you on some blood thinners to make sure that no clotting will happen, because you'll have to stay on the bed for about 6 months initially, until it eventually, with physiotherapy and certain gradual graded exercises, until you come back to the level that you can walk. Are you with me, Alex?
Yes, doctor.
But however, even though the process takes such a long time, eventually by about 1 year time, you will be able to get back to your baseline. Thank you so much, Alex. I will give you some reading materials and I will do the referral. And if you have any questions, you can always get back to me. Thank you.
Okay, so Dr. Chadu, it was a really nice performance. Most of the thing you cover, your approach was nice. But the thing is, did you mention me about the risk of the surgery?
Initially, I told about risks. I explained the surgery, then I said infections, bleeding, and damaging the adjacent structures like nerves and vessels and the ligaments. And also sometimes during the surgery, it's a ball and socket. So the socket can sometimes, there are like bone fragments can be chipped and fractured. So those kind of risks I told.
So if you mention the risk, it's fantastic. Another thing, how you proceed with the follow-up, that's okay, but make sure like after the surgery, you are also referring this patient to the rehab. That means it including physiotherapy, occupational therapy. They are going to, teach how to spin the new joint and improve flexibility. Those things you need to address. Okay.
Yeah.
Okay. So let's discuss the case. Otherwise, your performance was really nice. Have you booked your exam?
No, I'm waiting for a date.
Okay. So best of luck.
Thank you.
In here, a 60-year-old man with arthritis of right hip wants to get total hip replacement. Wanted it last year, but the GP said the symptoms weren't bad enough. Your task is take a history, explain in general terms the process of total hip replacement, its risk and benefit. In here, if you notice, you will get this type of task in your exam. Most of the time, your predominant assessment area is explain or counsel the condition. So make sure like you are asking very short history, 2 minutes or 2 minutes, 30 seconds, that's fine. No need to spend too much in history taking, because patient already has a problem like arthritis of the right hip and wants to get those total hip replacement. And he wants to know details about that. So in this case, the history, very quick history, introduce yourself. If your patient is in pain, you can offer painkiller after ruling out any allergies. So those are the common terms. Now coming to the history. In history, like very quick, how long do you have this pain and how it is affecting your life? May I know about, do you have any other joint pain, limb, then pain, how long, is it getting worse day by day, anything makes it worse, anything makes it better, those things. Now coming to the whom do you live with, past medical history, family history, smoking, alcohol history, that's okay. That is your very concise history. Okay, here if PFE is your task, I would suggest like PFE only. Here you will get positive antalgic gait. Sometimes you will get restricted movement in all direction in the hip joint. So that would be your positive point. So how you are going to explain total hip replacement? So you can say like, definitely it's a surgery to replace the damaged part of the hip with man-made parts. Okay. our aim should be to improve your pain and improve your movement. Okay, and it is commonly recommended people who are having severe hip damage and that affects your life. When the pain medication is not helpful for you, that time we are going for total hip replacement. And during hip replacement surgery, what we are going to do, damaged bone or cartilage, we are going to remove it from the hip joint and we are replaced it with a metal or the plastic parts. Okay, usually the surgery takes 1 to 2 hours and we are putting you sleep by giving general anesthesia. Okay, when we are making you fully unconscious or in sleep, you can mention it. So in here, basically a patient coming to you regarding total hip replacement, you can say total hip replacement, what we are going to do, we are just remove. In here, hip joint is the ball and socket joint. So the ball of the hip and the socket of the hip joint, we are replacing both. Okay. Now, indication of the hip replacement, which condition we are going for total hip replacement, any like severe osteoarthritis, rheumatoid arthritis, any arthritis or pain following any hip injury. Okay, if there is blood supply hampered on the hip joint, we can go for total hip replacement. Also, any hip disease from the birth. Okay, and like no pain medication is relieving the hip pain or is really affecting patient daily life, that time we can go for hip replacement. And benefit, what is the benefit? Please make sure you are using that word. That is, our benefit is we are going to reduce the pain, improve mobility and improve quality of life. How Dr. Chatu explained, that was really nice, like what benefit we'll get it. And in here, make sure you are mentioning about risk of hip replacement. It's the key point. So hip replacement, what is the risk? Here, risk during the surgery. So during the surgery, injury to the surrounding structure, bleeding, anesthesia risk, after the surgery, infection, blood clot, hip dislocation can very common, especially in first few months after the surgery. You can notice one leg feels shorter than the other. Sometimes nerve or blood vessel injury. Sometimes swelling can happen. Or despite of hip replacement, you still feel pain. So those are the risk or complication. Okay. Now, very important, another key point is follow up and the recovery. Okay. You need to mention your patient. Usually after the surgery, you have to spend few days in hospital. Okay, and that time you need to walk to help your mobility. And like we are advising people who are having recent hip replacement surgery, you need to avoid avoid in sitting in low chair or running, squatting, jumping for next 3 months. Another thing is the recovery. Recovery is really recovery is slow. You will need to do rehab. Okay, it including physiotherapy, occupational therapy. They are going to teach you to strengthen the new joint and improve flexibility. So, like sometimes it will take time to get back normal activities. Usually, you can say it will take like 6 to 12 months. Okay. Sometimes they will ask you, like role player might ask you, like, doctor, how long that hip replacement lasts? You can say it depends. Sometimes it lasts like 15 years. You can mention it's 15 to 20 years. That's okay. Okay. So that's the case. Any question for this case? If no questions, so we can move to the next one.
Can I do that next?
Can I do
case?
next one?
Who is in the queue?
I'm in the queue.
I'm waiting for a long time.
Okay, so let's check. Okay, Dr. Zodi.
Yeah. Thank you.
Yeah. Okay, you want to start?
Yeah. Thank you. Hello, my name is Jody. I'm one of the GP here. May I confirm your name?
Hi, doctor. I'm Mark.
Okay, Malcolm, very nice to meet you. I can see you here because you are the carer of James, and you are thinking there's some behavior change of James. I'm really pleased you come to here. So what we are going to talk in this conversation will be kept between you and me, and unless there is harm to James or yourself or anyone else. Is that okay?
Okay.
Thank you, Mark. So can you tell me more about what about your concerns and what do you mean by the behavior change?
Doctor, what I noticed like last 2 to 3 months, James is behaving oddly. Like sometimes he's become confused and sometimes become very aggressive to the other staff.
Okay, and the 2 to 3 months ago, he was fine?
Yeah.
Okay, is any particular things happens before this happened?
No, doctor.
Okay.
Not aware of that.
Okay, so may I ask who does James live with?
James is living in support accommodation.
And is he working or he got enough financial support?
He got support.
Awesome. Is any stress in accommodations?
No, not that I'm aware of.
How's his relationship with other people?
It was good previously, but 2 to 3 months, we noticed sometimes he become very angry, sometimes become confused.
Okay, any particular things make him angry?
We're not sure, doctor.
That's okay. And how did he sleep?
Sleep is okay.
How is his appetite?
Appetite is okay.
Okay. Does he still enjoy the things he used to enjoy?
I don't think, doctor.
Okay.
I
In
feel he is irritated nowadays.
okay. So by any chance, James being smoke, alcohol,
No,
any recreational drugs as far as you know?
no.
Okay. And so I can see from history he's on he's on medication, carbamazepine, the valproate. May I ask you, so how is his seizure controlled?
Seizure control, doctor. He's on medication. He has a seizure last 6 months ago. Yeah.
Okay, so is that a new medication?
He's on that carbamazepine and valproate for a long time.
Okay, so when's the last time he's seen a specialist?
I'm not sure, doctor.
That's okay. And are you aware he's been taking the medication on a regular time?
I think so.
Awesome. Does he complain any side effects from the medication, such as like a drowsy or any weight problem?
No.
Okay.
No, not aware of that.
Okay. So by any chance, James have an idea of harming himself or other people?
No, doctor, but he is recently verbally aggressive, very moody recently, and not sleeping well.
Okay. How is his mood? Is it up and down?
He's moody nowadays.
Okay. And you mean he not sleep well? Does he feel hard to fall asleep, or he wake up early in the morning?
I think hard to fall asleep.
Okay. Do you feel he's anxious?
I don't think so.
Okay. And by any chance, he mentioned he can see and hear things people couldn't?
No.
And does he mention someone trying to control him?
No.
And does he feel he had a special power?
No.
Or guilty?
No.
Okay. So by any chance, he got any like a flu-like symptoms or infections?
No.
Okay. And does he have any weather preference?
No, doctor.
Any change with his bowel motion, like diarrhea, constipation?
No.
Any trauma recently? Any injuries?
No. Trauma, yes, doctor, there is a history of motor vehicle accident when he was 12.
Yeah, but after that, he was okay? He's okay?
Yes.
Okay. Thank you.
Are you talking about after that any history? That motor vehicle accident, after that, he has some mild cognitive impairment after that.
Sorry, can you say it again? He has a mild
Cognitive impairment after the motor vehicle accident.
Okay. Thank you very much. And any other, does he have any mental illness?
No.
Any family history of any mental illness and a chronic illness?
No, I'm not aware of that, doctor.
Okay. And you also mentioned he had a seizure 6 months ago. And after that, he's well controlled with the medication?
I think so, doctor, because within this 6 months, we haven't noticed any seizure.
Okay. By any chance that he mentioned he got any diarrhea, vomiting?
No.
All right. Okay. So any change in his life recently? Anything particular happens?
No.
Okay. Thank you. Thank you very much. So Mark, and there's a few things can cause his confusion because it can be some organic disease, but like infection, thyroid disease, and head trauma, but from history is less likely. And can also because some anxiety conditions, and but it's no change in his life. And so what I'm thinking is he got I'm not sure for this one.
Okay, your history was really nice. So just give me some differential. That's okay.
Okay, sure. Yeah. So for his behavior change, I assume it can one of the possibilities can be the mood disorder, like many episodes in bipolar, can also be cause of acute psychosis, can also because of the drug-induced psychosis, but she's not on in any drugs. Can also because of like fluid, because an electrolyte imbalance. Thank you.
Your time's up.
Yeah.
Okay. That was good differential. Your history was fine. It's Dr. Judy. I want to tell you, look, sometimes you need to read your stem very carefully. In your stem, diagnosis already given. Did you notice it?
No, I didn't say that.
Look, they are already mentioned patient with acquired brain injury. So that's the diagnosis. Now, KRR is concerned about patient recent behavior changes. So you need to add those diagnoses, and it could be other, like patient also has a history of seizure. It could be like complication of the seizure medication. Those things you have to mention, like drug-induced psychosis. Those things you can mention. So let's discuss the case. The diagnosis is it's a acquired brain injury, okay, which is common after like traumatic event. In here, motor vehicle accident, there is a trauma happen, and after that patient has already developed mild cognitive impairment. Okay, so here you are a GP, you are about to see the carer of a known patient at your clinic. The patient is a 27 years old James with acquired brain injury, complex partial seizure, and mild cognitive impairment due to MVA when he was 12. The patient is currently living in support accommodation and is on financial aid. The patient medication already given. The carer is concerned about patient recent behavior changes, and the carer has the consent to talk. Your task is taking history, diagnosis differential with a reason. Look, STEM already mentioned patient diagnosis. So why not you are telling that those diagnoses? Here, always remember AMC clinical is a junior level exam. Okay, whatever already specialist made a diagnosis in the hospital, we couldn't change. What we are going to do, we are just add on something, but patient already diagnosed one of the diagnoses. We are not changing that diagnosis. And that AMC clinical is junior level exam. It's not like a specialist level exam. Okay. So your history, it should again, if STEM already mentioned, carer has the consent to talk, so you can proceed. Otherwise, you need to ask about the authority. Okay. Confidentiality statement, you need to build a rapport. Then history of presenting complaint. Here, history of presenting complaint, you should ask about the carer. What is the specific concern regarding Jane's condition? First, think about organic cause, then think about psychosocial problem. Okay. So organic cause, we need to ask about any recent fever, any recent infection, trauma to the head. Yes, that is positive. How long? When he was 12 years. What was the behavior after that? You have to ask. Any headache, any weakness after that. Then any palpitation recently, any chest pain, any weather preference recently, any bowel movement change recently. Psychosocial history, because there is a mood problem, you should ask about detailed psychosocial history. Mood, yes, he's irritated for the past 2 to 3 months. He's very verbally aggressive to the other staffs as well. You should ask about any self-harm or any harm to the others. Like other thing you need to ask about, how about the eating, any weight loss, how about the sleep, and then paranoia, persecutory delusion, hallucination, those things you need to ask. headaches, home situation, patient is living in the support accommodation. Okay, so how about the relationship with other family member? Do they visit frequently? You need to ask. Okay, any stress at home, and do you think he still enjoys his hobbies? Does he smoke? Any alcohol intake? How about friends? Any partner? Those things you need to ask. Any prescribed medication? Yes, he is on some medication. He's taking it regularly on the prescribed dose. You need to ask. Okay, any known allergies, any past history, family history, any mental illness. Now, patient is on valporate and carbamazepine. If you notice Step mentioned any of the medication name, please make sure you are asking some question regarding medication. Okay, so I usually follow the mnemonic, that is DISCO. D for duration of the medication, I for indication of the medication, why you are taking this medication, S for any side effect of the medication, O for any DISCO, DISCO. C for compliance of the medication. Are you taking with the regular prescribed dose? And O for other over-the-counter medication. Okay, that is DISCO. You need to ask about details, medication history. Now, any past history, any family history, any mental illness? Yes. When was the last time he has this seizure episode? So your diagnosis is it's a acquired brain injury, most probably due to motor vehicle accident. Okay. Acquired brain injury is the result of damage to the brain that may occur any time in the life. Okay. What are the symptoms, or you can say what is the acquired brain injury can be caused by? Acquired brain injury can be caused by many reasons like trauma, any history of stroke, drugs use, poisons, or any infection, those things, or degenerative brain condition. Okay, in this patient, acquired brain injury happened due to history of trauma. Okay, symptoms of acquired brain injury: patient may present with you physical symptoms like weakness, shakiness of the hand, any stiffness, poor balance, feeling tired, those things. Sleep problem, very important, or change in the sleep pattern, seizure activity. Okay, those are the physical symptoms of acquired brain injury. And some of the memory problem, concentration problem, confusion, communication problem, those also problem any patient may experience those things. Okay, many patients also experience with behavioral changes as well, like mood problem. That's why those are the collective symptoms of the acquired brain injury. How we are going to make a diagnosis acquired brain injury? We need to do many tests to make a diagnosis. Patient already diagnosed case acquired brain injury. Okay, but if you notice memory function getting worse day by day, you need to check patient memory again, and you have to do some blood tests to rule out any organic cause. Okay, what could be your acquired brain injury treatment? Multidisciplinary team approach. Okay, but as a junior doctor, you can mention about some investigation, then you are going to refer this patient to the specialist because it's a multidisciplinary team approach. Okay, our task was mention the diagnosis and differential, not the management. So what could be our differential? Our differential could be psychosis. Yes, those differential already Dr. Jodi already mentioned. Depression it could be because there is a sleep problem. It could be dementia. Okay, it could be delirium. If you if you notice any organic problem, you can mention it. It could be adjustment disorder, but adjustment disorder less likely because patient leaving this support accommodation for a long time. You should ask like how long. Okay, it could be schizophrenia, bipolar mood disorder. So those are your important differential. Smoking needs to stop. I'm thinking you may be talking about the previous case. Definitely, like whenever you notice your patient giving you history of smoking, you can mention that time with your consent, I can arrange another consultation. But guys, I want to tell you one thing. Always think about priority. If you are telling those things, but you are running out of time and you couldn't mention your important thing, there is no point of focusing all those like smoking, alcohol, recreational drugs. If that is really like important in your case and you can manage with time, definitely you need to proceed. Okay, can I do the next? Yes, Dr.
Can I do?
Yes, you can be the next one. Just wait, I need to check the question. It can be same acute brain injury medication. Okay. So any question regarding this case? Today I'm going to discuss most of the 2021 hot topic, okay? And also I already discussed maybe one or two cases which came as a pilot one. So okay, let's do the last one. Who will be the next? It's Dr.
Asha.
Okay, sure. Your 2 minutes starts already.
Yeah.
You want to start?
Yes.
Okay, let's start.
Hello, Veronica. My name is Asha, one of the doctors here. And I can see your file that you're coming in because of your tummy pain. How are you feeling at the moment? Do you have any pain? Anything uncomfortable?
No, doctor, I already took medication. I'm okay now.
Okay, Veronica, thank you for waiting for the result. Before discussing about the result, I'd like to ask some questions regarding your condition and then talk about your condition. Is that okay with you?
Okay.
Veronica, do you have any idea about this pain, any concerns? Could you tell me more about it?
Yes, doctor, I want to know why I'm having this pain. and you have done some investigation. I want to know investigation report.
Okay, definitely we will discuss about the investigation and the results. Veronica, is it the first time that you've got it?
No,
For how long have you had these symptoms?
I'm having this pain, like I would say, for the last few months.
Okay, and do you notice any relation between your periods and this pain?
No,
And anything that makes it better or worse? So, for instance, any specific position or eating or anything else?
if I'm changing position, like sometimes sitting, I feel better.
Okay. And regarding your pain, I can see that the pain is in lower part of your tummy. Does it spread anywhere else?
No, sometimes it's going my back or in my buttock area.
Okay. And what type the pain? Is it sharp pain, dull
It's
pain?
very dull pain.
Dull pain. How would you rate your pain on the scale of 0 to 10, with 0 being no pain at all and 10 being the worst?
Today I feel, doctor, it's almost 6 to 7.
Oh, and any remedies for that? Have you been taking any medication?
I took paracetamol.
Okay. Does it work?
Sometimes.
Okay. Apart from this pain, do you have any nausea, vomiting?
No,
Any fever, any rash in your body?
no,
Any skin discoloration?
no,
Any trauma to your tummy?
no,
Have you noticed any lumps and bumps or weight loss lately?
no, doctor.
Okay, thank you. Veronica, I'd like to ask some sensitive questions. Let me reassure you that everything is confidential between us unless any harm for your others, okay?
Okay.
Regarding your periods, when was your last menstrual period?
It was 2 weeks ago.
2 weeks ago. And do you have any problem with your periods, any excess pain or any excess bleeding?
No,
Any pain or bleeding between periods?
no,
Okay. And are you sexually active?
yes, I am.
Do you have any pain during intercourse, any bleeding by any chance?
No,
Okay. What about your Gardasil vaccine?
yes, I took it in my high school.
And have you ever had any pregnancy, any miscarriage?
No,
Any surgery, particularly in your pelvic area, in your tummy?
no,
Okay. Do you have any difficulties with urination? Any painful urination, smelly urine?
no,
Any problem with your bowel motion?
no.
Thank you so much for your clarification. Let me talk about your ultrasound. The ultrasound is an imaging that shows some organs in your tummy, and shows that there are some stones in the gallbladder. Gallbladder is an organ sits behind the liver in upper part of tummy in the right side. However, your symptoms are not compatible with these stones, and these stones are very common. There is no inflammation signs and no signs suggestive of any blockage in the ducts, and so it's less likely that your pain is because of that. I will explain to you about the management of your stone. Do you with me so far?
Yes,
And another thing is there are some follicles in the ovary. Ovary is the egg sacs, and follicles are so common, particularly in your age. And also there is a little bit fluid in some part of the pelvic area we call patopdoculus. Sorry for using medical terms. You don't have to memorize that, okay? All these findings highly suggestive of condition we call Mittelschmerz pain. Have you ever heard about it?
No, doctor, what's that?
Veronica, it's a very common condition. It means that the pain meets part of cycle. It means that when the egg released from the egg sac and the rupture of some part of egg sac, so it comes with a little bit bleeding and pain. It's very common and benign condition. There is no necessary for worry about this situation. Another thing regarding your blood test, let me reassure you that the inflammatory markers, liver function tests, all come back normal and unremarkable. And so all these confirm the possibility of this diagnosis. Do you have any questions so far?
How you are going to manage it?
That's a very good question. First of all, for management, the most important thing is conservative management. It means that over time it will be decreased, and also if you have a good lifestyle, such as have a healthy a diet, exercise regularly, sleep, good sleep, and good hygiene can reduce your pain. Another thing, some medication can be very helpful. We can start with the simple painkillers such as ibuprofen and so on. But if it doesn't work for you, we can try the combined pills.
Okay, your time's up, doctor. So, doctor, your performance, like your approach was fine, history was nice. Only one question you missed. You didn't ask me the frequency of my tummy pain. Otherwise, like how you explain ultrasonography report, that's okay. Diagnosis, it's a ovulation pain, that's also fine. Management, yes, you focused on Michel Mars pain, that's okay. But how you are going to manage that gallbladder stone?
Yes,
address
because I wanted to explain about it at the end of the
Okay, that's fine. So overall, the performance is fine. So let's discuss the case. Here you can see 25 years old female Veronica is coming. You are a HM at the hospital because she is having right side lower abdominal pain. Pain already relief. You have done some blood test ultrasonography report. You need to explain those report. Your task is take a history, explain ultrasonography report, diagnose differential, and further management. Okay. Here, what could be your differential? Any female coming to you, reproductive age, complain about tummy pain. Okay, so based on it could be incomplete abortion.
Hello. Hello.
Hello.
Hello. Como su pipi?
So it could be incomplete abortion. It could be primary or secondary dysmenorrhea. It could be ectopic pregnancy. It could be mid-cycle pain or ovulation pain. It could be PID. It could be ovarian cyst, endometriosis, any or medicine surgery related is appendicitis, stone, gastroenteritis, any UTI. Those are your differential. Now, definitely introduce yourself nicely. Offer painkiller after ruling out any allergies if your patient is in pain. But STEM already mentioned patient pain is stable now. Okay, so start asking about HOPC, pain quotient. Is it first time happen or not? Severity. Okay, then site of the pain. How long do you feel pain? How frequent? I told you I'm having this pain for last few months, but you should ask about how frequent that pain is. How do you know that it's a like ovulation pain? You have to ask the frequency. That time I would say like, doctor, I notice it like every month, only 1 or 2 times. Okay, radiation, characteristics of the pain. Is it persistent or coming and going? Any relieving, aggravating factor? You need to ask. Yes, there is relieving factor. Any specific position change, pain like gets relieved. Your differential, you should ask about fever, nausea, any vomiting, any tummy distension to rule out appendicitis, because your next task is to explain the ultrasonography report. Based on the ultrasonography report, you have to rule out your differential as well. Problem with the pee and poo to rule out UTI. Very important or key point here, 5 P's. P for period. So you should ask about, do you think your pain is related with your period? No, it's not related with the period. When was the last menstrual period? It is your key point. You have to ask when is the last menstrual period. How about the cycle? Any concern? How many days bleeding? How many days apart? Okay. Do you have a stable partner? Before asking that stable partner or like private question, you should give confidentiality statement. Okay. Safe sex, are you practicing safe sex? Any problem with intercourse, especially do you feel pain while doing intercourse? Any STI before? You need to ask about pill question, because IUCD also can cause pain. You should ask about any pill or any contraception history. Pregnancy, past medical surgical history, SADMA. Okay. Now, how you are going to explain ultrasonography? You should say, ultrasonography report showing that there is a mature follicle on the right ovary and a small amount of fluid we notice in the pouch of Douglas. What does it mean? It means in our tummy, between the womb and the bowel, there is a small space. We call it pouch of Douglas, and we notice some fluid over that area. Okay. And I also notice there is follicle on your ovary. Okay, that means that ovulation is happened, which is a mature follicle when it ruptured. When it ruptured, it released the egg. When it released the egg, so definitely a small amount of fluid is coming. Okay, so it's a good sign. It's not a serious condition. It's good sign of fertility. But another thing I also noticed, in our liver, just below the liver, there is a gallbladder, which helps in our digestive system. I noticed there is a small stone, but there is no sign of inflammation. So it's not a serious condition as well. And you don't feel tummy pain in your right side, upper part of your tummy. So it's just an incidental finding. So your diagnosis and differential. Differential is appendicitis. It could be appendicitis. What is that? You can say it's the inflammation of the appendix. It's the rudimentary part of our gut, or you can say just a worm-like structure in our gut, which might be infected and can cause inflammation. We call it appendicitis, but you don't have that sign symptom like tummy pain, or EPS patient have tummy pain, but you don't have any nausea, vomiting, or tummy distension. Those things you can mention. Infection of the urinary tract, but you don't have any pee problem. It could be inflammation of your gallbladder, but we notice there is no sign of inflammation in the ultrasonography. Okay, so our diagnosis is the Michelmar syndrome or ovulation pain, because when that follicle release, so that fluid coming out, and that fluid can irritate the covering of your tummy, and that can cause pain. Okay, so management is just supportive treatment. Panadol for pain relief. You can use some warm pack or heat pack in your painful area. For gallstone, what we can do, we can just wait and watch. But if you are really concerned, I can refer you to the surgeon for second opinion, because it's the incidental finding. So no need to worry at this stage now. But you have to provide the red flag. Red flag are similar pain with fever, vomiting. You have to report to emergency department. And finished with 4R. Okay, so that's the case. It's the Michelmar syndrome or ovulation pain. Your another differential, it could be PID, but there is no discharge in your private area, no fever. Okay. Question indicates that her pain is relieved. Should we ask about pain? Yes, because patient presenting complaint is pain. You have to ask details pain question. Would you like to please explain pouch of Douglas again? Yes, you can say pouch of Douglas is the small space between our womb and the bowel. Should we talk about OCP, pain not resolved with pain clear? You can mention, but always go like mild, moderate, severe in this way, okay? So first think about like all the pain management, painkiller, heat pack, those stuff. And if that's not working, then later stage, we are also going to give OCP. But before that, we are going to do again some investigation as well. Okay, in appendix, it could be appendicitis, but you should say appendix, which is a worm-shaped structure in our tummy. Okay. There could be infection and inflammation of that area. We call it appendicitis, but you don't have any sign symptom like nausea, vomiting, or tummy distension. Okay. Oh, if you notice they mention like appendix is not visible, so mention it could be appendicitis, but it's not visible in the ultrasonography. So it's less likely. Hi, doctor. Sorry, back to acquired brain injury case. Do you need to send the patient to ED? For what reason you are going to send this patient ED? If your task is management, for acquired brain injury case, as I mentioned, acquired brain injury, the treatment, it could be like multidisciplinary team approach. Okay, at this moment, patient coming to you some mood problem, confusion, and also irritability. At this stage, no need to admit this patient in the hospital. We are going to refer this patient to the specialist. They are going to treat it as a multidisciplinary team approach, because the acquired brain injury, that disease is a progressive condition. I mean, what are the causes? Dr. Rosa, I didn't get your question. In here, I already mentioned the differential. Differential, it appendix not visible. The causes are. What is yours? What is your source? Okay, so that's all in our cases.
All right, so how did it go, everyone? So thank you so much, Dr. Cynthia. I was here most of the time, but yeah, it was a great session to me. And like the cases that you have discussed, it's really, really important for the exam. And I hope that you guys enjoyed it also. So this is exactly like how the classes are going to happen. Normally, as you can see that we have started your free 2-week session, and that's a part of the course as well. That means the people who are joining the course, it's a part of their course already. So you are actually doing our course at the moment now, but this is a free 2-week session to know about the course in depth, so that you don't end up thinking that, well, this course initially was really nice, but at the end, I did not get what I really wanted. So just to avoid that feeling, which a lot of candidates have from a lot of other institutions, and just to make sure that you guys are getting an informed information about the course, this 2 weeks free session is just for that. Okay, no other courses actually offer you the 2-week session, never ever. So I hope that you guys are learning about us, and also you might be liking the way we are approaching. Now, the importance of doing random cages are really, really high, because in exam, you will end up getting new cages, because that's how it is. Never ever you can say that, well, I'll just do some of the previous cages and some important cages, and then I will get all the cages in exam. Never ever it's going to happen. There will always be changes. There will always be new questions and cages. And this is how you get to understand that feeling. Like all of you who did role play today, you guys did amazing, because this was just random in front of you. And you did not know what this case is all about. And you just did by your knowledge and experience. And that's how exactly in exam it will be most of the time. So this class is mainly focused on that feeling and that experience, that you know, if a new case just comes before your eye, what to do and how to approach those sort of questions. All right. So thank you, Dr. Cynthia, so much for taking the class. And yeah. And I know that a lot of you will have a lot of questions about these cages, because these are cages which we haven't done any theory yet, and you don't have any cluster of these cages at the moment. But by the time when we will do a lot of clusters in the theory sessions, most of these cages, you will know how to approach the cages just by your knowledge from those clusters. Okay. And on the top of that, these cages, which are very, very important and high yielding for your exam, this will also help you to prepare your exam. And by doing the 5 months course in this way, most of you will be able to appear the exam by 6 or 7 months. Unless if there is a delay in taking the exam, that's not how we can help. That's actually a luck, and also how COVID is playing around you. That's depend on how you can register yourself for your exam. But if you are lucky and you get a date, you should be able to appear the exam just after 5 months course. I would advise keep a 1 or 2 months to do a good revision and do all the role play of these cages again, and then go for the exam. Okay, so is there any question? And Dr. Javed, as I said initially, that this is a random role play session. The role play sessions are 2 kinds in our course. One kind is like this one, which you just do it randomly. There is no clusters or theory sessions based on this. There is another role play sessions that will be taken by me, which will be related with your theory sessions. Like you will get one in near future, which is when we will do our another cardiology theory session. The last class will be just on cardiology theory role play. So all the cases that you have done as a theory on cardiology, we will also do role play on just cardiology. So you can understand that how much role play sessions you are going to get in this way. Okay, and as I said, that there is a lot of chance to do role play if you come forward. A lot of candidates, they don't come forward to do the role play, but if you really want to, there will be enough opportunity to do a lot of role play. Okay. All right, so I hope that you guys enjoyed this session. The next class will be on cardiology session 2. So that's already the schedule out there. You can just join, just similar like tonight's session. Okay, our last date of admission is 15th of February. So in case you want to start your registration for the course, feel free to email us or contact us through Messenger. We'll be more than happy to help you. Okay. Thank you all. Have a good night then. And again, thank you, Dr. Cynthia, for a brilliant session.
Thank you all. Bye.